So at PCDC, we believe that primary care should be and really is the heart of the healthcare system. High quality, affordable, accessible, and well-resourced primary care is the key to healthier people and communities and to achieving health equity. And we believe that primary care can bend the cost curve, although frankly the costs for primary care have to go up in order for the total costs of care to go down. And primary care institutions are really part of the anchor of any community. They provide valuable jobs and good career paths. Let's talk about this question in the context of health equity, right? So there is this concern that the safety net, in order to save money, is not actually providing the most or the best or the highest quality care. And so poor people get watchful waiting and rich people can demand an MRI for anything. And how do we think about the whole question of training and the right of patients to make sure that they're getting the best care when we're looking at essentially what we have is a many-tiered system, certainly at least two and probably many more than that.
We have to change the culture of what it means to be a patient and what we expect as the norm, because as you said, if every rich person is getting a colonoscopy, everyone who doesn't have resources is going to say, I should have one too. And so now we see, even though it's not recommended, 80-year-olds being prescribed colonoscopies because, and no one is going to, as you said, I have not had another one because I'm like, well, there are other things that work just as well. But so I think we have to change what's normative in our medical culture.
I think while we haven't fully moved the understanding that social factors may be a better way of achieving health, that the medical model that we learned in medical school is applicable to a certain set of diseases. But then there's all the rest of life. And the rest of life is generally not best dealt with through medical examinations and x-rays, but that's somehow how it happens, right? So, the people are in stress, people are having difficulties, they come to the emergency room, right? You saw that when you were in practice, right? But the emergency room isn't actually the correct answer, and I don't mean just because they have sniffles. I mean that the things that are taxing them cannot be fixed by the medical profession.